of us want to live a long, healthy life. So here to talk to us about aging and some secrets to longevity, Dr. Mark Williams. He's a geriatrician with New Hanover Regional Medical Center. Doctor, I appreciate the time this morning. Thanks for coming in.
Bob, my pleasure.
I don't want to say you have secrets because it's well documented, you know, diet, nutrition, don't smoke, those kind of things. But right off the bat, how long are we living these days?
Bob, the statistics are staggering. A baby girl born today at New Hanover Regional Medical Center has a 50-50 chance of living beyond the age of 80.
Wow.
Now let me put that in context for you. In the days of the Roman Empire, 2,000 years ago, the average life expectancy was 35.
Wow.
In 1900, the life expectancy at birth was 47. That means it took mankind 19 centuries to increase the life span by 12 years, from 35 to 47. And in the last 100 years, we've increased it from 47 to 80.
Modern medicine, ain't it great?
Unbelievable.
Wow. That's insane, to put it in that context. I'm doing the math in my head. That's unbelievable to me.
And what it means is that growing old, which was once the privilege of the very few, is now a realistic expectation for each of us. Everyone watching your program has a 50-50 chance of making it to the age of 80.
And again, we were talking very briefly about the ways to get there. I know the advancements of medicine help individuals get there, but what are the things that you're seeing people do to reach 80 and beyond?
You know, it's very interesting. Medical science teaches us that about 75% of our longevity has to do with the environment.
Okay.
Air, water, food, exercise, not smoking, good diet. That means that 25% is in our genes. So while we'd like to brag that our Aunt Mabel lived to 102, in realistic terms, that's not going to have that much to do with our longevity.
Okay.
So it's key, really, to keep a positive attitude and to realize that we have to plan for growing old now. It's not, we can leave it up to the winds of fate, or we can take a more proactive, planful approach to our aging.
How important these days is, trying to think of the best way to phrase it, but I don't want to say mental capacity, but just to keep your mental well-being going as well to help you get to an older age.
Oh, that's very, very important. Really, I think in order to age well, you need to remember 5 simple things. One is know the reality, the fact that we really have a good chance of making it to 80 and beyond. The second, challenge our body, exercise and physical activity. The third that you emphasize is stimulating our intellect, keeping mentally active and avoiding habits that just wrap our brains into a cocoon that spare us adaptation to unpredictable circumstances. The fourth area is managing our emotions, and particularly getting rid of negative emotions so we can appreciate positive aspects of life. And the fifth, and also important, is nurturing our spirit. So if we know the reality, if we challenge our body, if we stimulate our intellect, if we manage our emotions, and if we nurture our spirit, we have a very good chance of living a happy and productive old age.
Yeah, it amazes me. A gentleman I used to work with here, his grandfather now, I believe he's 99 now, still mows his own lawn, still does things, and that is one of the things that he often tells. He said, my grandfather's just so mentally sharp.
And a lesson that I learned from a farmer in rural North Carolina, I asked him what his secret to longevity was, and he said, I worked up a good sweat every day.
Yeah, it's great to hear that now we are able to get past that and beyond. Doctor, I appreciate the time this morning.
My pleasure.
Thank you for coming in.
Okay.
We're back with more Carolina in the Morning after this.